Welcome back everyone to sqadia.com. My name is Mohammad Usama and today we are talking about environmental pathology. This specific part in this series of lecture is going to be about environmental chemical injuries because of different type of pollutants and toxins in our environment. So we are going to talk about a lot of different type of those pollutants and toxins such as methyl alcohol, carbon monoxide, carbon tetrachloride, cyanide, lead, and polychlorinated biphenyls, and others as well. So let's start off with carbon tetrachloride and cyanide poisoning. So carbon tetrachloride is actually a combination of chlorine, which is a halogen, with carbon, and it usually leads to central lobular necrosis and fatty changes in liver when exposed to. On the other hand, cyanide poisoning is a very commonly heard term, and it is a very potent toxin and poison. And the early symptoms of cyanide poisoning include headache, dizziness, tachycardia or increased heart rate, shortness of breath and dyspnea, and vomiting. These symptoms are then followed by seizures, slow heart rate, which is bradycardia. So initially there was tachycardia and then bradycardia, and low blood pressure and loss of consciousness, and resulting in cardiac arrest and eventually leading to death. So onset of symptoms is very rapid and it is usually within a few minutes, and if not properly managed, it can suddenly lead to death. So if a person even survives, there may be a long-term neurological problems in that individual. And what is actually the pathology of the pathological background of the cyanide poisoning? So cyanide poisoning is a form of histotoxic hypoxia. So histotoxic means damaging the tissues by impairing the blood supply, impairing the oxygen supply to the cells, because when there is cyanide poisoning in an organism, the organism is unable to create adenosine triphosphate, which is the energy source for the cell, and without which the metabolism, either anabolism or catabolism, cannot occur. And this happens in cyanide poisoning because of the inhibition of the mitochondrial enzyme cytochrome C oxidase via the cyanide, resulting in inability of the cells or the living organism to create adenosine triphosphate. So cyanide poisoning should be suspected of these symptoms occur: exposure to fire, smoke in an enclosed area, altered mental status such as confusion or disorientation, and soot around mouth or nose. Now, another one is carbon monoxide poisoning. It is very important and it is very common. Usually when someone is, you may have heard that people died, especially in winter when they were sleeping, and that is because of the heater, which is working on natural gas like methane. It was turned on and eventually it turned off, and due to that release of methane, or you can say incomplete combustion of methane, carbon monoxide was produced in the absence of oxygen, and that actually leads to carbon monoxide poisoning and death. So how does this occur? So before that, let's look at the symptoms. So the symptoms are usually flu-like, and they include headache, dizziness, weakness, vomiting, chest pain, and confusion. And large exposures can result in loss of consciousness, arrhythmias, which can lead to death as well, and seizures. So long-term complications may include a person feeling tired and having trouble with memory and amnesia and movement problems and disorientation and abnormal coordination. So how does carbon monoxide poisoning occurs, or what is the effect of carbon monoxide? So carbon monoxide has a very strong affinity for hemoglobin as well as myoglobin. So hemoglobin is a compound which is present in the blood. It binds with oxygen and then takes oxygen to the tissues where it is required. Similarly, myoglobin is in the muscles, and which binds with the oxygen and provides oxygen to the muscles for the production of ATP or whatever purpose it is required for. But in the absence of that oxygen, then different types of symptoms occur, like we have already discussed, because carbon monoxide, when it is present, even if oxygen is present, it has a greater affinity for hemoglobin, myoglobin, so that may result in abnormal consciousness, arrhythmias, seizures, chest pain, movement problems because of the myoglobin involvement and muscle involvement, and even death. And it also has the capacity, the carbon monoxide, to bind with mitochondrial cytochrome oxidase, which is present in the mitochondria, but the affinity is lower as compared to oxygen. So it would only occur if there is a severe hypoxia. And thus, carbon monoxide, by binding to either hemoglobin, myoglobin, or mitochondrial cytochrome oxidase, actually restricts oxygen blood supply. So let's review the signs of carbon monoxide poisoning. So headache, nausea, dizziness, breathlessness, collapse, and loss of consciousness. Now, methyl alcohol poisoning. So methyl alcohol is actually a type of organic compound, which is of the type of alcohols because it has an OH group. So when consumed, it is converted to cellular toxins, formaldehyde and formic acid, which leads to transient metabolic acidosis, and that actually damages cells of retina in the eye, optic nerve, which is leading from the eye to the brain, and the central nervous system. So these are the major reasons because of which methyl alcohol poisoning actually leads to blindness, which is a very common manifestation of methyl alcohol poisoning. Now, lead poisoning. Lead is it used to be a very common compound found in paint as well as fuel, like, for example, petrol. So what used to happen was that paint, for example, in children toys, when children used to put those toys in their mouth, and that paint can go into the child's body, so lead poisoning could occur. And the other type was when that petrol was burnt in those different vehicles, so the smoke coming out of it consisted of lead, which was very poisonous. So automotive emissions could also lead to lead poisoning. But nowadays, in majority of the countries, the leaded petrol is no longer sold, and we usually observe that unleaded petrol is sold, so that there would not be a greater amount of lead poisoning related to automotive emissions. So what happens because of lead poisoning? It results in red blood cell changes, which is characterized by basophilic stippling and hyperchromic microcytic anemia in which there are small red blood cells, so they do not have that exact or normal capacity to carry oxygen, and that results in symptoms of anemia. The second is encephalopathy, in which brain can be involved, and that results in irritability, seizures, and sometimes even coma. It can also result in neuropathy, which may manifest itself as wrist drop and foot drop. Both, on the other hand, wrist drop is actually caused by a problem in the radial nerve, and foot drop via a problem in the sciatic nerve. It can also result in Fanconi syndrome, which is the impaired proximal renal tubular reabsorption of phosphate, glucose, and amino acids. Another common or characteristic manifestation of lead poisoning is lead line, which is viewed as mucosal deposits of lead sulfate at the junction of teeth and gums. So you can look in the oral cavity and you can look for the lead line in case of diagnosing or assessing for lead poisoning. And another manifestation is that the lead gets just like calcium, it gets deposited in bones, and it results in increased radiodensity of long bones. So they would appear more white on X-rays. So lead is toxic, especially for young children, and because they are most vulnerable, because their nervous system is still developing, and they can absorb as high as 4 to 5 times more lead than adults when exposed to. And this results in intellectual disability because their central nervous system is still growing, underperforming at school, and behavioral issues. On the other hand, in adults, lead exposure increases the risk of ischemic heart disease and stroke. And in pregnant women, once again, lead exposure damages many organs, but once again, it also affects the developing fetus. Other environmental chemical injuries include mercury chloride, which can result in focal gastrointestinal ulceration and severe renal damage, vinyl chloride, which can lead to hemangiosarcoma or angiosarcoma of the liver, which is a malignant tumor in the liver, ethylene glycol, which can lead to transitional cell carcinoma of urinary bladder, and polychlorinated biphenyls, which are actually non-biodegradable pollutants, and they are usually found in the formation of adhesives and plastics, but now they have been banned and they are not allowed to be used in the manufacture of these products because of their highly toxic nature. Because exposure to polychlorinated biphenyls lead to chloracne, which is because these products have chlorine, so acne secondary to the exposure to the chlorinated compounds lead to chloracne and impotence, sexual impotence, and visual changes as well. So that was all about environmental changes, and I hope you learned a lot in this lecture. And please keep on visiting sqadia.com for more lectures like this. Thank you very much.